So we're at Theatre Clwyd this morning for the 2025 Social Prescribing Conference. It's a really important event for 2025 and Well North Wales. A big part of what we're trying to achieve is the creation of a movement for social change, particularly around addressing avoidable health inequalities. We're excited at the role that social prescribing will play in that, and we're looking forward to hearing from a whole range of speakers today who will hopefully stimulate us to create the network for social prescribing across North Wales, something that's truly made here for the people that we all serve.
Hi everyone, my name is Leanne Monks and I'm from an organisation called Elemental. And Elemental is a tech for good company, and what we do is everything around social prescribing, and we use digital to connect up communities. We're really excited to be here today at this conference because everyone is in the same room talking about social prescribing, and everyone's on a mission to make social prescribing mainstream. Thank you very much.
So today is a really big day for North Wales because we've got our first regional social prescribing workshop and conference. So we know there's a lot of good work happening across North Wales. What we intend to do is harness all that energy, all that experience, and to create our own Made in North Wales brand of social prescribing. So it's not about stifling local initiative, but it is about bringing in a regional coordinating role, regional rigour and regional support so that we can make sure that the whole of North Wales can thrive with the social prescribing agenda.
My name's Clare Burton and I'm the chair of 2025 and one of the founding members of the 2025 movement. I got involved with 2025 because I was outraged and ashamed that depending on where you live, in Flintshire or in North Wales, your life expectancy is very different. So in some of our poorest communities, people who are born today will have 7 years less life expectancy than people born in other parts of our county. We were in the middle of a major regeneration programme in Flint where we were demolishing 240 homes, and what I wanted to make sure was that when we built the new homes that we also offered a range of services that would address that avoidable health inequality. We've two key work streams that we are working on at the moment. One is around addressing food poverty and the other one is around helping people to lead more active lives. And this conference today fits perfectly with that. Social prescribing is, I guess it's one of the fancy terms of the moment, but what that means to me is almost taking us back to how communities used to live, where neighbours and friends would support and help each other, would invite the person living on their own around for tea, would go out and visit people, check they were okay. And today's about learning from some of the fantastic practice going on across North Wales, and for me, seeing how we could bring that to Flint.
My name's Madge. I work for the Office of the Future Generations Commissioner. I'm really pleased to be here at today's event about social prescribing. We think that social prescribing is the key to changing people's lives in Wales because we need to shift from seeing illness as a problem to understanding the importance of being well and the importance of a range of factors in that, from your job, your community, how you eat, how you live, what you value, what you enjoy. We've got to get away from just seeing illness as a problem that needs to be solved, that someone else solves for us, and really thinking about the whole of our lives and how that can keep us well. And I've been really impressed today to hear about how that is already happening in North Wales, and I think that the rest of the country can learn an awful lot from what you're doing.
I'm Margaret Hanson. I'm involved in the 2025 movement. I'm one of the original founders. I'm here at Theatre Clwyd today to support the Social Prescribing Conference. I think it's really important that everybody in North Wales who's involved in social prescribing comes together, and this is the first opportunity that we've had to do that. It's taken 2 years to get to today's event, so I'm highly delighted that we're overprescribed, having a great time, and hopefully lots of good work's going to come from this in the future.
I'm Dr. Pham Williams. I'm a GP in Healthy Prestatyn Iach, which is a health board run surgery in Prestatyn. And I'm here today because of our close links with the Artisans Collective in Prestatyn, and we are presenting about our own experiences of social prescribing, and we're also here to learn about other people's experiences of social prescribing to try and develop our own methods. And actually it's just been a really inspirational day to hear about other people's stories.
Okay, my name's Alexis. I'm one of the occupational therapists from Healthy Prestatyn Iach, and I'm here today at the 2025 conference on social prescribing. And we've been talking about the occupational therapy role and how we make links between kind of clinical practice and getting out there into the social world and meeting people's wellbeing needs in real life.
My name's Peter Harrison from Artisans Collective in Prestatyn. I'm here today at the 2025 conference about social prescribing. We've been invited today to talk about the good work going on in Prestatyn with Healthy Prestatyn Iach and our involvement as Artisans Collective with the things going on at the doctor's surgery as well as in our social enterprise. So today we've presented, it was a 15-minute presentation with myself, Pham, one of the GPs, and Alexis, one of the occupational therapists. And we've had lots of questions at lunchtime. Sometimes these events are more about social networking than they are the actual presentation. So we found it a great day today.
So my name's Kate Hamilton. I work for the Future Generations Commissioner, and I've come along today at the invitation of Movement 2025. Yeah, we've identified social prescribing as a priority area for the Commissioner to work on because it's a great illustration of the kind of thinking that we need for future generations, taking healthcare out of treatment and medical facilities only and expensive care and taking it back to where it starts, which is, you know, people's well-being starts in their everyday lives, in their homes, in their communities, in their relationships. And if that's where well-being starts, then that's where we should be putting more focus and attention as the basis of our health as a nation.
Hello, my name's Dr. Allison Hughes. I'm a GP in Llangollen and I'm a cluster lead for South Wrexham. I'm here at this social prescribing event today just to see where all the projects that we're all very busy working at tie in. Within the 3 Wrexham clusters, we have a reception navigating project going on, where we're trying to upskill our reception staff to be able to signpost our patients at the front door to all the various services that are out there that will just try and address their needs potentially better than coming to see their GP when there's such a demand on GP appointments. It's been very useful seeing everybody from all the different sectors all in the same room and how we all interlink together and how we're all trying to do the same thing in slightly different ways. So I think all that networking can be very useful in how we all move our projects on.
I'm Tony Downs. I'm a GP in Connors Quay in North Wales, and our practice has become a Bevan Commission exemplar site. What that means is we are able to lead in innovations and changes in health and social care. It has been found by many studies that a lot of ill health is determined by the social environment in which people are born and raised and live. And we've found now through lots of research into brain science and to other sciences is that the brain function and body function can alter in a way that can alter health-seeking behaviours too. What we're proposing with Key to Wellbeing is on the basis that if a problem is socially determined, rather than a medical solution, we are going to find social solutions. And this is where the idea of social prescribing is going to be very, very helpful. So what we're looking to do is to collaborate with a range of stakeholders in our area, and then we're also going to be looking to working with the people who use services, people themselves, to co-produce the pathways and the care that they actually need.
Right, I'm Geraint Davies. I'm cluster lead for Conway West Cluster in the Conway area, in the central area of the Health Board. I'm also a health and social care facilitator with the local County Voluntary Council, CVSC. As a consequence of one of my practices, GP practices, experiencing difficulties, the lead partner identified that up to 50% of appointments could be better dealt with in the social or voluntary sector setting. And so we established what is termed a social prescription scheme, but it's more of a community navigation scheme where primary care and social care refer patients who may be more effectively dealt with in the social setting to a navigator who refers them on to existing provision in the social setting, generally by the third sector. It's very successful, it's received very, very well, and overwhelmingly the patients that have experienced the service are very, very positive, and I commend it for the future, and I think it is the way to go.